I typically tell owners that if what I'm doing is impacting their day-to-day quality of life of their pets, then I'm not doing my job. We can offer a lot of treatments and diagnostics on pets that have cancer that can improve their quality of life. It is common for us to recommend radiation therapy either in our cat or dog patients for various reasons. One would be a post-surgery scenario where the surgeon was not able to get all of the cancer cells out and there's still some at the original incision. Other scenarios would be in our pets that can't have surgery. There are areas that you can't do surgery in, such as the nose. So we typically recommend radiation therapy for nasal tumors or brain tumors. So it's commonly used either with surgery or by itself.
Radiation oncologist is a veterinary oncologist that is specifically boarded in radiation therapy. Radiation therapy is the treatment and study of high-energy x-rays that are targeted at tumors, and it's localized to an area in order to attack the cancer cells within the area that will go on to cause DNA death of those cells, which can hopefully decrease the tumor size or decrease the risk of recurrence. So unlike chemotherapy, where we give a systemic treatment, it goes throughout the body, radiation therapy is thought of more like surgery in the sense where we're treating primarily one site.
At Fetch, we have access to really great equipment for radiation therapy, including a linear accelerator, which has megavolt and kilovolt imaging. The kilovolt imaging provides us with a cone beam CT, which we can use prior to each treatment, positioning within millimeters of where we want the patient to be. The megavolt imaging provides a port film, maybe for patients that don't have CT guidance, to confirm patient positioning and make sure we're treating the area of our interest. We also have a strontium probe, which provides superficial treatment to really small areas, which we can provide in a single treatment typically. Our kilovolt imaging as well on the linear accelerator with these cone beam CT allows us to provide stereotactic radiation therapy, stereotactic body radiation therapy, where we deliver, instead of 10 to 20 treatments, which we classically use for radiation treatment for nasal tumors, brain tumors, we use the stereotactic radiation therapy to deliver the same goal, the same doses over 3 to 5 treatments instead of 10 to 20. This means less anesthesia for our pets, less side effects, better tolerance of our radiation procedures and radiation treatments. When pet owners are referred to Fetch for radiation therapy, it's a scary experience because your pet may have been diagnosed with cancer, or maybe we don't have a diagnosis at this point, but cancer is a high suspicion. My job as a radiation oncologist is to provide you and your family with the most information possible about this type of tumor, or the type of tumor we suspect is causing your pet's problems, where we then can stage your pet, figure out if any other areas of the body are involved with this type of cancer, and then figure out what the best option for treatment is going to be. Is that radiation therapy? Is that surgery or chemotherapy? Or is it just comfort care, really focusing on quality of life if none of these other options are possible?